So we're here with our integrative nurse allergy specialist Lorelei, and Lorelei has been working with the team for a while, delivering a very important health service, working with allergies and desensitization. Can you tell us a little bit about what is allergy desensitization?
Yeah, so allergy desensitization is essentially reprogramming the immune system to an allergen that we have developed a sensitivity to.
So we've lost our immune capacity to understand that allergen and we're reacting to it constantly, which is a huge drain on the immune system. There can be a lot of cross reactions that happen as well. But how is the desensitization that you're doing different from general allergy desensitization?
Yeah, so thank you for that question because it's really important for our patients to understand. Really, this approach to desensitization was culminated from one of the leading founders in integrative medicine in Australia, and that was Dr. Merv Garrett. And he passed this information on to Dr. Carl Romick and Dr. Anne-Mary Amber, who really redefined these formulas and protocols with keeping in mind of a holistic approach, which was looking at the gut health, looking at atopy in genetic and a genetic disposition to allergy, looking at hormonal changes within the body, the environment, and our exposure to allergens.
Dr. Anne-Mary also often talks about the load. And so it's that beautiful culmination of knowledge between those integrative practitioners that has sort of given rise to this new form of desensitization, which we're actually practicing at the moment, which is brilliant.
Yeah, that's right. And these practitioners really understood atopy and they understood about keeping the allergy load low to better improve our quality of life and the quality of life of their patients.
That were really suffering from this atopic, this allergic predisposition, be it asthma, be it eczema, be it hay fever. And Lorelei, there's a lot of patients that I'm working with you with, and I know that it's such a straightforward way to take some of that load off. Quite often, there's big dietary changes that these patients need to make. Their immune system's not working, so they're constantly dealing with viral or bacterial infections that they just can't quite recover from. They do fantastic with intravenous vitamin C, but it doesn't have a lasting effect. And what I really love about this work is you're actually educating the immune system.
Absolutely, Reine.
And it's pivotal.
It is pivotal. And what is so important about this modality and why I'm so passionate about it is because we are treating the cause of the allergy. So we're not masking the allergy, we're reprogramming the immune system.
Yes.
And this is for genetic and generational in the bloodline. So it is very important work.
Amazing work. I'm so excited for it. I'm so excited for it. So how do you work out which allergens to treat?
Yeah, so it's always a combination of past medical history, family history, and we do a skin prick test that will show up very quickly. It's within 15 minutes. We'll get a positive result to allergens. Also, somebody might come to me with a known allergy from a blood test that they have done with other GPs prior, and we can treat from that.
Right, just from a RAST blood test that's picked up.
Yes.
Yeah, lovely. And what do people need to know before they attend a skin prick allergy test for the results to be accurate enough to do the prescription?
Yeah, so the main thing to keep in mind is to cease all antihistamines, steroids and high-dose vitamin C 3 to 5 days prior to testing.
Beautiful. 3 to 5 days prior. I often forget that one or I muddle that one up. And there's a common dietary recommendation that's made alongside the treatment. Can you talk a little bit about that?
Yeah, so the main dietary issue or food that causes the most issue that I see is dairy. And there's a lot of patients that suffer with allergy will also have dairy intolerances. And it's the casein in the dairy. So it's a protein that is very inflammatory and causes a lot of mucus production in the system. So one, we want to have the body as deflamed as possible for the drops to have the most uptake, but also we want to have a true reading of the symptoms that are caused from food or from the environmental allergens.
And there can often be that beautiful cross reaction. I wrote an article on it just recently around a patient that had serious birch reaction, but he was having a reaction to all the birch foods in his mouth. He was
Yes.
having that cross reaction. I think it was banana, avocado, and there was one other food that was just lighting his mouth up.
Yes.
And as soon as we started the drops, the birch drops, like within the first load, he could tolerate those foods.
Yes.
And so it was quick, and it's so interesting, that cross reaction, that it's not actually those foods that he was reacting to, it was the birch cross reaction.
Yeah, that's exactly right.
Yeah,
yes.
So that was exciting to work out. How often do patients need to check in with you once they start a treatment protocol? Can you tell us about length?
Yeah, I can. So the program is 18 months, and we often see the patient every month for the first 3 months, or until we establish their correct dose.
Yeah.
And then we often see them maybe once every 3 months during that time.
And that sort of initial correct dose can be tricky. Like sometimes patients will start and they'll have a reaction.
Yes.
And then sometimes they'll start and nothing will happen.
Yeah, that's right. And it is different for everybody. And this is why it's such a customized treatment plan. Yeah. And we really walk together with you on that journey.
Yeah, beautiful. Yeah. Lorelei, thank you for carrying the baton on this work. I know you're working in closely with Dr. Anne-Mary still on this. And I am so, so grateful to have you on the team and really helping our patients achieve health and wellness.
Yeah, thanks, Reine. And it's a real honour to be bringing this modality to the community. So thank you.